So we're going to change gears. We are now going to talk about liver resection for non-colorectal, non-neuroendocrine liver metastases. So I've got to give you a few slides in the beginning to differentiate colorectal cancer from other. Now, why is this important? Primary liver cancer is going to be characterized by the paradigm of hepatocellular cancer. We're not talking about that. Metastatic cancer to the liver takes the paradigm of colorectal, but not really. Remember, the colon and the rectum drain directly through the portal venous system back into the liver or back into the systemic system into the lung. Thyroid cancer, breast cancer, melanoma, sarcoma do not drain directly to the liver, but they are draining systemically. So these are going to be tumors that want to go to the liver, but don't follow local regional pathways. So if we were talking about colorectal cancer, the take-home message would be the following. Careful patient selection based on appreciation of the disease biology. So if you're going to talk about any tumor other than colorectal cancer, you must appreciate the biology of breast cancer, of melanoma, before you make the decision of what to do. So when I divide any talk about metastatic disease, these are the things that I consider. I consider tumor biology, I consider the effectiveness of systemic therapy, regional therapy, the role of ablation, the role of surgery, and patient selection. This is the clinical risk score for colorectal cancer. You may remember this from the year 2000. It's also known as the Fong score. And what this score did is it told us that if your score was 0 to 2 based on these factors, liver tumor size and number, CEA level, disease-free interval, lymph nodes, LDH, etc. If that score was less than 2, then this was going to be your 5-year survival. Notice that it goes from 40 to 60. If that score was greater than 3, notice that your survival drops down. So I'm not going to be as excited about operating on an 80-year-old with a Fong score of 4, because that patient's not going to do well. Here's the problem. We don't have a score for breast cancer, for melanoma, for thyroid cancer. So we have nothing to guide us.